डिपॉजिट करते हैं, आप देख सकते हैं पूरी आंखों के अंदर मेरी। ओ भाई, पेन तो यू कांट।
Got on 2 ties and 2 belts.
Okay, you know what that is? Clear up. Don't even worry about it.
Thank you so much for being with us today, for taking your time out of your BD schedule. Yeah.
Busy schedule.
Again, thank you so much. What did the line I say before it? Hey everybody, Dr. Bob here, and today we'll be reacting to some eye memes out there, and I've got here my great friend Dr. Samiksha Maya. So let's get into it. That has to be AI. Like,
Definitely.
because I've seen the real tattoos out there where they take the injections and they directly inject to the sclera, the white part, and
Yeah, subconjunctivally.
yeah, and I think they spread it all over the ink. Gives that black eye effect, right? Like how bad, like what danger things can actually happen if, like, because of these eye injections and tattooing things people are doing.
Well, what I feel is mostly they do not do it under aseptic conditions. I'm not really sure, the ink that they use, and even basically I'm really not sure of how sterile the syringes that they've been using and things like that. So honestly, yeah, this looks pretty much AI, and what you see is basically a pen kind of a thing that they're using here. So
Yeah.
that is not what they actually use for tattooing.
Because the other one is the ink which is used, and I think it's that the heavy metals in the ink can even lead to other complications associated with that. So one thing I wanted to ask is, like, this injections right now to just on the surface, just below the surface, the sclera. Suppose this ink, what if it went more deep inside? What could possibly go wrong?
Oh, like I said, so basically what they use is a syringe. So if this needle basically enters into the eyeball, inadvertently the ink might also enter into what's called as the vitreous cavity. So what we have basically is a jelly inside our eye. So 90% is the jelly. So if this ink enters into the jelly, it would stain the jelly aspect, or it could also damage the retina or cause an extensive hemorrhage, that is bleeding into the vitreous cavity. So these are all a couple of risks that we can have, and the patient can also go blind.
So if that's the case, then you'll have to remove that part of the
Yep,
vitreous.
absolutely. So that is what we call it as the vitrectomy surgery that we'll have to do.
Right,
So this ink can actually incite a lot of inflammation. So we will have to go in and perform a surgery, remove all the ink, staining the vitreous cavity, try to restore the patient's vision.
So when did piercings for eyelids start to be a fashion?
People have been doing weird things, so this is one of those really weird things. So I guess she's already undergone a surgery. I think
Probably.
she looks like her right eye is an empty socket, and then what you could see, the white part was basically scleral shell.
Okay.
So she's kept a shell to protect her, underlying mucosal structures, and then she's piercing it. Honestly, this is not something that's cool, because let's say in a patient who's probably having intact structures of the eyeball,
Yeah.
if they resort to something like eyelid piercing, this would probably cause torrential bleeding from the lids, because they're highly vascular, or it could also cause damage to the cornea, or if the metal piece that they're using for the lid piercing could also pierce the eye as well, as long as they don't use eye shields. So lot of complications.
Yeah.
So lid piercing, honestly, it's a no, guys. Don't go for it.
आईबॉल टैटू बोलते हैं इसको। मतलब आंख पे 6 से 7 जगह पे नीडल से इंक डिपॉजिट करते हैं, आप देख सकते हैं पूरी आंखों के अंदर मेरी। ओ भाई, पेन तो यू कांट इमेजिन। से पहले डेथ वारंट साइन करना पड़ता है, इसमें 12 से 15 लाख रुपए का खर्चा रहता है।
Death warrant.
First of all, he's paying 12 to 15 lakhs. Then he is signing up for the consent he's giving, and multiple injections.
Yep.
Like, is it even worth it?
Well, no, definitely not. I think we're all blessed with a beautiful white sclera. I think it's the best color we could ever have in our eyes, which makes all of our eyes look so beautiful. Going and getting stuff injected into that sclera is honestly not a cool thing to do. And talking about the viral death warrant, guys, it is not a death warrant. We call it as the guarded visual prognosis or a nil visual prognosis. Basically, we're explaining to the patient that you might also lose your vision, and this is a written and informed consent for medical legal purposes that the individual is supposed to know what has been done. So yeah, that's about the viral death warrant. And yes, multiple injections will be required, and as I already said, it carries a risk of perforation and might require surgery in the future, so a lot of mess ups.
Is this the air puff test? Is this the air puff test? All right. Wait, is this the air puff test?
Why is that it's a thing that everyone's scared about this air puff test? I mean,
Okay, so this video basically explains about he first enters into the dome kind of a thing, which we call it as the Humphreys visual field analyzer. So it is that, and then he tries to get binocular vision testing, and then there also he asks, is it an air puff test? Honestly, it's not something that is really to be scared about. So air puff test is nothing but a method. Or it's basically a machine that's available to check the intraocular pressure, mostly in glaucomatous patients, where a small puff of air comes and indents onto the patient's cornea. So basically, whenever there is this puff of air indenting the cornea, it tries to measure the IOP. Why they're so scared is just that they end up blinking their eyes and they feel that there's something that is suddenly coming, a gush of air coming and hitting their eyes. So it's just that. So it's as simple as that. So there's nothing to really be worried about. I mean, it's something really hilarious, but honestly, it is not as scary as it really seems in this video.
Okay, which one of these lines is the easiest one for you to read?
Oh my God, am I tripping now? Look like you got on 2 ties and 2 belts.
Okay, you know what that is? That's a normal, that's a double vision.
And 2 tablets
Okay,
now.
yeah. That'll clear up. Don't even worry about it. It's a distance thing.
Oh my God.
Your eyes will return to normal.
what an amazing prank. Like harmless way among all these insane pranks.
She's getting confused. Am I seeing double or is it actually double? Poor thing. He's confusing her.
Nice.
Okay.
Quality prank.
Well, yeah. So whenever we go to any ophthalmologist, the optometrists basically perform this test called as a binocular vision test. This is basically to look for strabismus, that is squinting. So basically, patients who are having squint will actually present with a symptom called as diplopia or double vision. So mostly diplopia is associated with cranial nerve palsies, or there could be an intraocular tumor, trauma. Any of those conditions could cause squint. So it's always advisable for patients who are having double vision to please go get your binocular vision tested.
Right. Watching the video till here and found something valuable and informative, you know what to do. Don't forget to leave a like and share this video with your friends out there and comment down what you guys want me to react to next.
Follow my fingers with your eyes.
Good.
You're retarded.
That's impossible. It's impossible.
If you're retarded.
I'm not retarded.
There are some physiological indicators. For example, if your hand is bigger than your face, you're retarded. You're retarded.
Oh my God.
That's a good one. Well, I remember doing these pranks to my friends, like if your hand is bigger than
in
your face.
UG, yes. We were taught all these concepts in UG, yes.
And I think the test what he did was supposed to be this edge test, right? Like Like with one hand he's supposed to do, and not like that.
Yeah. Ideally, we're supposed to test it uniocularly, like the examiner and the patient both occlude each of their eyes. And then we test that part of the eye first, followed by the other one, and then both eyes together. That is uniocular as well as binocular. We'll have to check. So this hilarious way of doing that, just popping the fingers out, well, that is not how we actually do. We just follow the pattern of letter H, while we try to ask the patient to fixate on the tip of the finger while the examiner moves it towards the direction of the cardinal gazes. So this is again to check the binocular vision and
eye muscles.
Yeah, so basically to look for the function of the eye muscles.
Yeah. Just putting a nose. Oh my god, I think it will be really relatable for you.
Absolutely. Oh my God, I've had such kind of patients every single day, not having any idea as to where to place their chin, where to look at. Do they have to look at our ears or our eyes or straight into the light? It's a total havoc. But honestly, it is not so confusing, guys. You just have to keep your chin on the chin rest and put your forehead onto the forehead rest. That's it.
Maybe they don't understand, probably.
No, as in, what is so confusing to understand that there are just two strips, like one at the top and one at the bottom. They just have to keep their chin. What is so confusing? I really don't know.
Oh boy, I have pretty much seen patients come like this with the attenders, very irritating attenders.
This happens with, the pediatric patients. As in, there are these couple of grown-up young children, like 10 to 12 years, and then they're trying to tell something and the parents like, hey, shush, listen, this happened. Doctor, this happened, that happened. Why don't you just let the child talk? As in, when the child can actually give you proper and accurate history, please try to take history from the patient or the child himself or herself. And obviously, patient's parents can pitch in when the child is too young and cannot give appropriate history. So that's all about it.
Ah boy, squint. Well, obviously it's exaggerated here.
Everything is exaggerated. From pulling the tourniquet so tight and probably tapping the fingers so badly.
On the other hand.
Yeah, and then injecting onto the belly probably. Well, and only to realize that the person who's doing this test has got squint. Well, guys, it's not really as dramatic as it's seen here, but yeah, people do have squint. They have really bad squints. Like, we measure squint with respect to degrees of exo or exotropia, that is whether it is inward or outward turning or upward or downward turning of the eyeball. So yeah, whenever there is tilting of the eyeball you see in your child or anyone whom you love or know, please visit an ophthalmologist and get yourself checked and tested. Some of those conditions could be corrected by doing a surgery. God, honestly, every kind of a patient I've seen, every kind of patient. Probably, yeah, we don't really encourage our patients to use mobile phone while we are examining them, but I think the down gazer, star gazer, yeah, these are the most common. They really do not know where to place their chin and they're busy rotating their eyes all over. And then, yeah, it's honestly so irritating. But the point is, there could be some patients like those who are differently able may not be able to understand the commands that we give them to properly align and position for good ophthalmic examination. However, yes, a good communication from the doctor's side and a good understanding from the patient's side is quintessential for proper ophthalmic examination.
So as you know, your eyes don't heal like skin and you don't get a second set. And if you get your eyes injured, it's like probably like the very delicate organ out there. And definitely kudos to all ophthalmologists out there. And obviously, Samiksha, you too, for doing your great job and continue your same work out to the society and helping eyes. And hopefully we can catch up for our next videos out there. And as always, you guys, take care, stay safe. This is Dr. Bao.
Dr. Samiksha.
Signing on.